Good morning, everybody, and welcome to the first meeting of the Citizens' Assembly on Gender Equality for 2021. I'd like to start by wishing everybody a happy and a gender equal new year. We all know, I think, that this is going to be an important year for many reasons. The arrival of the large-scale vaccination to help us defeat COVID and all the international changes that we're getting used to, not least of which is Brexit. But it's also going to be an important year for our Citizens' Assembly. Because it'll be the year in which we conclude our work and send our recommendations to the Dáil and the Seanad. But of course, we still have quite a lot of work to do before we can get to that point. And I think one of the biggest challenges for Ireland and for the world, in fact, for the future, is going to be how we want to rebuild our economy and our society after COVID. I think during this extraordinary year that's just passed, many of us have been reflecting more deeply on what we want out of life and what changes we would like to see post-COVID. And all the discussions and the work that we're doing together in the Assembly, I hope will be an important input into that process as we do come out of this terrible time. And the link between the work that we're doing could never be more clear than today, because we're going to discuss the very important topic of care. Now, the whole issue of care and whether to simply delete the so-called woman in the home clause in our constitution or to replace it by a broad reference to the value of care. This was actually at the origin of calling this particular Citizens' Assembly. And you always hear me refer to the Oireachtas resolution that guides our work, but the part that we're going to be looking at today asks us to look at quite a complex set of issues, from early years parental care to facilitating greater work-life balance, the social responsibility of care, and the co-responsibility of women and men for care, especially within the family. As some of the speakers in our videos have said, at some point in our lives, each of us will need care, and most of us will be giving care to others. For some, this will be a fairly infrequent contact, and for many, it's more than a full-time job, and we'll hear more about that later today. I think the COVID crisis has shown all of us just how dependent we are on a huge range of people whose dedication and skills look after our health, our children, those who are most vulnerable in our society, our parents and our grandparents. And the crisis has laid bare many of the issues that underpin the work of our Assembly. And it has also raised important questions that we're going to be discussing. For example, why is it that so much of the caring in our society is done by women, inside and outside the home? Is it really acceptable that we put a low economic value on the contribution of those who work in the care sector? Is it acceptable that unpaid care receives very limited support? Why do paid carers earn so little while they do these demanding and responsible jobs? And why do so few men go into these areas of work? Now, we've discussed aspects of this already in previous sessions. So today we're going to ask you to focus in the morning on the area of childcare, and in the afternoon on care for people with disabilities and older people. I hope you've all been watching the videos that we've sent out, and in those you will already have got a very clear picture of the factual situation of care in Ireland. And it is interesting because, for example, in Ireland, we have a very high level of unpaid care, with women doing around 300 hours a week and men around 120. And in the table that was included in one of the presentations, we saw that only Italy and Portugal have higher figures than Ireland. It's also interesting that our care model is almost exclusively a private sector one. Of course, the state has policies on care, but it generally leaves the delivery of the care services to the market. And this also leads to the finding that our state spends comparatively little on early childhood care and education. We spend 0.3% of GDP. That compares to an EU average of almost double at 0.63%. And the Scandinavians, whom we're always referring to, they spend already over 1% of GDP on early childhood care and education. Now, what does that mean for us? It means that in Ireland, parents are paying very high fees for childcare, on average around 28% of their net income. And that compares to the EU average of around 12%. So we pay more than twice our European neighbours' average of net income on childcare. And for lone parents, that percentage can be much higher. It can even be as much as 40% of their net income. So in terms of then who does the caring and what they get paid, we've seen that almost everyone working in childcare are women, 98%. And 61% of them earn less than the living wage, and they don't get sick pay or maternity leave. And it's not surprising, therefore, that there's quite a high turnover in the sector. Almost 1 in 4 leave the sector every year. And the situation for people with disabilities and older people is similar. Care Alliance told us in the video that around 500,000 people provide some level of care to a family member with a disability. That can be, or for people with a long-term illness, a mental health concern, or people who need help with their daily activities. And here too, we see the high costs of private care for our elderly, and the fact that we now rely increasingly on migrant women to do the caring for us. Dr. Ursula Barry told us in her video about 20 to 26,000 undocumented migrant workers taking part in the Irish care sector. In the videos, you've also listened to recommendations from advocacy organisations, and Dr. Pauline Cullen in her video summarised the submissions to the public consultation. So these are all available to you, and the Secretariat has summarised all the recommendations from the advocacy and from the public consultation in the paper that you can draw on in your discussions. Now, I think it's important just to recall that we are here discussing these issues as the Citizens' Assembly on Gender Equality. There's a much wider debate going on in our society about these issues in general, but our focus is gender equality. But of course, any improvements that we recommend to Ireland's care system would benefit everybody and our society more generally. You will have noticed that in the videos, some of the advocacy groups refer to changes in the Constitution, and it's useful to bear these in mind during today's discussions. However, we're going to devote our next meeting on the 13th of February to the Constitution. So I think there's really no need to take a position or to discuss the constitutional issues today, but just be aware of where the topic and the legal framework come together. So now, before we move into the breakout groups, we're going to play a short video from the International Labour Organization. It's on decent work in the care economy. And its main messages, I think, are very relevant to us because their main message is that care needs to be measured, it needs to be recognized, it needs to be valued, and it needs to be redistributed between women and men. Immediately after the ILO video, we will replay Dr. Ursula Barry's video on placing the care economy at the centre of Irish society. And then after the two videos, both Dr. Barry and Dr. Noreen Hayes will be with us live to take your questions. So we're going to run the two videos back to back now, and then I'll come back to you for the question and answer session. I hope you enjoy today's discussions, and I look forward to engaging with you as the day unfolds.